Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good evening, everyone, and welcome to Pause for the Truth. I'm your co-host, Jocelyn Turner, and I am joined by my co-host, Dr. Rogers Kane. How are you doing this evening, Dr. Kane?
I am doing just fine. I've still got both feet on top of the ground, and I can be very happy about that.
Well, that's a good thing, and it's nice and toasty here in Northeast Florida, right?
Wasn't too bad. Wasn't too bad today. I had a little overcast, so I was happy with it.
All right, all right, all right.
But I was inside also.
Well, that part too. Well, thank you to our wonderful listeners for spending part of your evening with us for what promises to be an informative, inspiring, and deeply meaningful conversation. Tonight, we are discussing sickle cell disease, stories of resilience, advocacy, innovation, and hope. Sickle cell disease affects approximately 100,000 Americans and millions more worldwide. While it is an inherited blood disorder, its impact reaches far beyond the physical symptoms. It affects families, educational experiences, careers, mental health, financial stability, and overall quality of life. Yet, despite its prevalence, many people still know very little about what it means to live with sickle cell disease. This evening, we are honored to be joined by individuals who bring unique perspectives to this important conversation. We have advocates like Dr. Selena Webster Bass, who's working tirelessly to raise awareness and support families. We have a courageous individual who lives with sickle cell disease in Frederiana Webster Copeland. I hope I said that in the right, Copeland Webster, and shares her lived experience. We have a remarkable guest whose life has been transformed through gene therapy, and that is Mr. Johnson. We have a representative from Life South Blood Center, Mr. Oh my God, I'm gonna mess it up. Can I just say James Scott?
James Scott, yeah. No, you're good.
Who will discuss the critical role blood donors play in supporting patients. And we have a leading pediatric hematologist and oncologist who will help us understand the science, treatment options, and future care. And that, of course, is Dr. Banso. Welcome to all of you. Thank you so much. Tonight, we are hoping that our audience will learn more, first of all, about sickle cell disease. You know, it's something that we hear about, but you don't know a lot about, right? You may have throughout your lifetime met someone who had it, and that's what we say, had it or has it or have it, all sorts of things. But realistically, Dr. Ben, so when it comes to blood disorders and sickle cell, people really don't understand what it is. So can we first, and I'm going to go, usually we give our guests an opportunity to introduce themselves, but I'm going to let you do that as I ask you a question, if you all would say a little bit about yourself. So Dr. Banso, for listeners who may not be familiar with sickle cell disease, let's start by asking you to explain what it is and how it affects the body.
Sure. Thanks for having me. I think sickle cell disease is a red cell disorder, and I think that's what makes it so challenging. If you think about genetics, you inherit your genes from your parents, and in sickle cell disease, you're inheriting two copies of the sickle gene, the hemoglobin gene that's got a small mutation in it that makes it sickle. And if you inherit that gene from both parents, then you have sickle cell disease. There are different kinds of sickle cell disease. There's SS, SC, S beta 0. There's different flavors based on the genetics that you inherit. But the essential point is that the hemoglobin protein is formed differently. It's shaped differently. Hemoglobin is a protein that carries your oxygen throughout your body, and hemoglobin is inside your red blood cells. So what happens is when you drop off your oxygen to various parts of your body, then this hemoglobin protein changes shape. And the issue with patients with sickle cell disease is that when the hemoglobin changes shape, they become quite sticky. And so the different hemoglobin proteins start binding to each other, forming very firm rods. And those firm rods inside of the red cell cause the red cells to change shape. So they become stiffer, and they also get destroyed faster. And so as a result, kids who have and adults who have sickle cell disease are anemic. So they have a low red blood cell count, and those red cells are misshapen, so they can get stuck in various places in your body. Because of that, and since blood travels to all parts of your body, you can pretty much name any organ in your body, and I can tell you a problem that sickle cell disease causes. So it's a pretty profound disease affecting pretty much every part of your body.
And is newborn screening the typical way that it is detected, or is some type of history, family history for the parents discussed during the expectant mom's pregnancy?
So all babies are tested for it at birth. So if any parent is 30 years of age or younger, they should know their sickle cell status. So they should know whether they have sickle trait or sickle cell disease. And with the newborn screening program, if the child does have sickle cell disease, then we are notified. We're the center in Northeast Florida. And then we actually go find the patients and bring them to our clinic. That way we make sure that all patients who have sickle cell disease are cared for. We try to get them in before they're 2 months of age. But that being said, I mean, on your newborn screen, you can also find out if you have trait. And, we don't get notified about all those patients, but the primary care doctors do. And so it's really on them to make sure that the families know if their child has sickle trait, because then that's something that the kid would want to know when they're an adult, because they would know if they could pass on the sickle gene to their children. So really, there's no reason in the US why nobody should know their sickle status. Now, if a patient is born outside of the US, it's a different story. So we do have a lot of immigrants who come in who did not know they had sickle cell disease, and they have some sort of problem, and then that's how we find it.
Yeah, I always tell people the importance of, when the summer is here and a lot of people engage in family reunions, I always recommend to people to have conversations. And Selena and I have talked about this, have conversations among your family to talk about those diseases that are prevalent in families. For some reason, some families don't like to share information about their health issues, but they don't know that it's so important that they do, so that they'll know that, hey, this is something you need to pay attention to. And like you said, everybody should know. Selena, I want to divert it to you now, because as long as I've known you, practically, you have been such a champion and an advocate for us. Tell us your story and what made this become a priority for you.
Yeah, thank you so much for having us on tonight, Jocelyn. We all appreciate the opportunity to raise awareness about sickle cell disease. So my journey with sickle cell disease started many years ago, actually in my undergrad years. My degree was in biology, and so that's where I started really studying sickle cell, but I had cousins with sickle cell. And I also knew that I was a carrier, that I had sickle cell trait, which means that I have one sickle cell gene and capable of passing that gene on to my children. So that's where it all started. And then I went on to get married and learned that my husband also had sickle cell trait, and he wasn't aware because he was born before universal screening started. And so had an amniocentesis, learned that indeed we were with child and that child had sickle cell. And unfortunately, he transitioned at the age of 22 months. And so it has been my legacy building work to raise awareness of sickle cell and to support families in the Northeast Florida sickle cell community. And so we launched Richard Webster Bass Health Institute, which is a nonprofit organization to support sickle cell families and to raise awareness. I also worked for a while with the sickle cell program at Nemours Children's Health and Shands Jacksonville. It was one program in 2 locations as a hemoglobinopathy counselor. So I was one of the ones that actually told parents that their child was living with sickle cell disease. And So that was very rewarding work, but it was also hard work as well. So been on this journey a long time, raising awareness and bringing supports, where they're needed.
Wow, wow, yeah. And I remember, about your son, and what a blessing that you turned. Let's see, how do you say it? You turned your pain into passion, or did I say it right?
To purpose, praying to purpose.
Purpose, pain
Yeah.
into purpose, because you could have just grieved silently, right? And you realized that you couldn't. You had to tell Richard, if you don't mind, Richard's story, and then also help other families. So bless you for that. And so talk about family, Frederiana. Listen, Frederiana, tell us about when you were diagnosed with sickle cell disease, and what was your childhood experience like?
Thank you for having me. Good evening, everyone. I was diagnosed with sickle cell before I was even born. My mom was made known by her doctor that, hey, you're going to have a child with sickle cell disease. And she still decided to have me. She grew up educating me about the disorder. I grew up basically going to Nemours, and I feel like I grew up at Nemours. I was actually treated by Dr. Bansel, and they gave me the best care, the best treatment that you could imagine. They educated me. They provided me with confidence, with all of the resources that I needed that they had available for individuals with sickle cell. Of course, I had my challenges, many hospitalizations. I've had blood transfusions. I've been on medications like hydroxyurea since I was a little girl to help manage the complications of sickle cell. Very painful pain crises, and I'm still going through these pain crises and having to learn every day how to cope with them, researching the new treatments and the cures that they have available, making lifestyle changes, and of course, keeping my faith in God along the way.
And I'll say amen to that. So when you talk about pain crisis, what does that feel like, and what do you wish healthcare providers and the public um, better understood about it?
Yes, so pain crises, I like to describe them as very sharp. I say it feels like I'm being electrocuted, honestly. Some people say that it feels like glass is going through your body. It's
Mm.
very sharp, but then there's also this constant achy pain from the inflammation in our body. Um, and what I wish people understood, there are, I want to say two things. I wish that people understood that there are so many different triggers to our pain crises. There is stress, which is something that's becoming more and more prevalent as I am an adult now. So life is so incredibly stressful. There are weather changes, very extreme cold temperatures, very hot temperatures. There is rain for me. Not everyone with sickle cell deals with this, but when it rains outside, I can feel it. Actually, before it even starts raining, I can feel it. My body is aching. There's dehydration. It's summertime. It's very easy to become dehydrated. We live in Florida. So there are so many things, and the list goes on, so many different triggers. It's as if just living your life, you can have a pain crisis come out of nowhere. And then also, I wish people understood that many people, they consider other disorders such as cancer to hold more weight than sickle cell, and it really shouldn't be that way. I'm a cancer survivor myself, but for some reason, when I go into the emergency room and I tell them that I am in remission for cancer, they send me straight back to a hospital room. If I go in there and I don't tell them, I'm waiting in the ER for an hour to 2 hours to 3 hours. And it makes no sense to me. Why is sickle cell and cancer treated so differently? Why does cancer hold more weight? Um, why are cancer patients given better treatment when it should be equal treatment? There should be equity among these disorders. And that's very disheartening to me.
Wow, I can't say I can't imagine that, because I cannot imagine. Dr. Bansel, I have to direct this question to you. what do because Fredriana mentioned how she learned a lot from you. So how do you approach this with family, especially someone as young as Fredriana, to explain it on a level that she can understand, and also helping her to understand the disease, but also how to manage it?
Well, first of all, Fredriana is a very smart young lady, and picked up
I
things
can
very, very
tell.
quickly. So she's not a great example of our typical patient. I mean, I think it's kind of an evolution. When the babies first come in, then we obviously spend a lot of time educating the parents. You can understand that this is pretty devastating in a lot of situations. You think you have a healthy kid who is a healthy kid. But we're talking about all the potential problems that their child could have. It's very scary. And then we also have treatments to try to prevent problems. Fredriana mentioned hydroxyurea. We're actually offering that medicine as young as 1 year of age. So, to put your 1-year-old or even less than 1-year-old on a medication lifelong is a big commitment. So we spend a lot of time educating the families, and we are bringing them in every 3 months in the beginning just to spend time educating them. They have to know about fevers. There's just a lot of things they need to be acutely aware of. So that is kind of the initial part of our time with them. And then what we're noticing actually is as these kids become 12, 13, 14 years of age, they actually don't know a lot about their sickle cell disease. One, because we do so much of the talking with the parents. And so, we kind of I notice sometimes, if you think about the patient being there, the parent being there, and us, we're kind of communicating directly with the parent, and the child is sitting there and not necessarily, participating in the conversation. So we've been doing a better job of trying to educate the kids starting at around 12 to 14 years of age, so that by the time they graduate from our program, because we can only care for the patients until they're 18 to 21, then they're well versed on the disease. So we use a lot of diagrams, a lot of visuals. I have to say, none of it's great. We try our best. I think one of the things we're missing, and this is where Selena comes into play, is I think that this goes better if patients are talking to each other. And so, having teens talk to other teens, I think, just like Fredriana just so eloquently described what a pain crisis is, I could never do, because I haven't lived with the disease like she has. So I think, working at a family level and a patient level will go far. And I feel like that's kind of where the future lies in terms of educating and making sure that the hard part is, like you said, Fredriana, about oncology versus hematology. I completely agree with you. And I think the big difference is that in oncology, there has been a lot more advocacy. There's been a movement that I think we're just beginning to do in sickle cell disease. And I think having these kinds of conversations and having people like Selena advocate for this group is going to go far.
Yeah, thank you. And I was going to ask Selena, what are some of the biggest challenges facing the sickle cell community?
Yeah, so I think that is a multifaceted response. I think one is mental health. One of the issues of sickle cell is that it's very unpredictable when you do have crises or other physical manifestations. I remember as a mom, I was constantly checking Richard's, head. Is he warm? Does he have a fever? Because we know if he has fever, he needs to go to the hospital. So it's just unpredictability about the disease, and that can really wear on your mental health and well-being. And then when you're in the hospital for extended periods of time, it impacts your schooling, it impacts your ability to go to work, right? And so your sense of self-confidence, your sense of self-efficacy is impacted. So I think mental well-being is an issue. I think for caregivers, oftentimes we don't think about the living grief that they're experiencing. And what I mean by that is they're grieving that their child may not have the same milestones that other parents may see in their children, or they may not have the same life. They had planned to go to the prom, had planned to go to an event, and then a crisis happens, right? So I think, it's that living grief of of not having the same experience as other parents. It's another issue. And then we know social determinants of health, having more month and money, or dealing with food insecurity, or dealing with accessing health care, right? So typically children are good, but when they start to transition to the adult healthcare system, there are challenges oftentimes with healthcare access. And even if they do access, as Fredriana has shared, there are oftentimes issues around compassionate care or culturally responsive care, or care that says, yes, we see you and we value you and that you are important. So I think those are some of the major issues that are affecting sickle cell families.
What I like about the Richard Webster Bass Health Institute and Selena is the opportunity to bring families together, because the support that they can offer one another. And then I remember when I attended, I was just in awe, because you had the physicians present, other resources present. What are some of the programs or resources that your foundation provides to individuals and families affected by sickle cell disease?
Yeah. So we do a lot of social activities because we want families to be able to take a break from all of the chaos of the hospital. So our last event was all about setting goals, doing vision boarding and thinking about, yes, I still have a future. Yes, I have challenges. Yes, it may slow me down a little bit, but I can still think about possibilities. I can still think about, future successes. And so, that was a place where we, had some information on mental health, as well as did some vision boarding. And of course, it always has to be food, right? That's how we like to break bread together. And then Fredriana leads an amazing teen group, and she does work with Project Little Veins. We have a sickle cell conference every year, and that's where we discuss recent advances in sickle cell disease management. And then we also have Thanksgiving baskets, holiday events, and so forth. So we try to provide what we can in terms of support to the family.
And it also adds normalcy, right? It gives you an opportunity to not think about that for that moment. Fredriana, what motivates you to advocate for others living with sickle cell disease?
Well, what initially motivated me is my aunt, Dr. Selena Webster Bass, watching her be the amazing, passionate advocate that she is and the community leader. She became my biggest role model ever since I went to that first event and she allowed me to speak at it. She's been my role model ever since. But in addition to that, it's also my compassionate heart, my heart to help others, seeing others who are dealing with complications that are far more severe than the complications that I deal with, dealing with dead bone tissue, seeing people with sickle cell who are in wheelchairs, seeing people who are in and out of the hospital every 2 weeks. And I have hospitalizations maybe twice a year. So having the heart to say, let me help others, let me do what I can. Even though I have this same illness, even though I have my own setbacks, let me do what I can to create these care packages and take these individuals things that I know will improve their quality of life. And then also, my setbacks also encourage me to push harder. When I'm in pain, I realize that, okay, what's something I would want right now while I'm having this pain crisis? I would want a heating pad. I would want a water bottle. I would want some massage oil, and incorporating that into the care packages that I provide for other individuals with sickle cell.
That's so awesome. In spite of what you're living with, you are just, following in Selena's footsteps. I'm gonna just call you Chip, a little mini me, because to put yourself aside. Now, Ernest Johnson, listen, everybody. You have got to hear Ernest's story. Can you share your journey living with sickle cell disease before you tell our audience what's happening with you now and the blessing that you received?
Okay.
So living with sickle cell disease, like I was talking about earlier, we found out when I was 4 months, and I basically grew up in the hospital, like Frederiana said, Nemours. That's all I knew was Nemours and Wilson Children's Hospital. And at those type of hospitals, you receive amazing care because you're kids. So I just remember always being in pain, always being in the hospital. And then as I transitioned into an adult, I still had that pain, but you had to transfer hospitals. So I think I started going to Mayo Clinic, and it was the same care. Great doctors give you your pain medicine, but it wasn't until I started attending Florida A&M University in Tallahassee. That's when I started experiencing, the stigma. I remember having a crisis, and I think I went to Tallahassee. I think it's Tallahassee Memorial TMH or something like that.
It is.
Okay, yeah. So I had a crisis, and I had to get admitted. And I remember just crying and screaming to the top of my lungs. And a nurse walked in, and she said, "Why don't you hush? There are people in here way sicker than you."
Mm.
So it wasn't until I got to college and I started experiencing the things that sickle cell warriors experience on a daily basis. Another instance, I went to the ER and nobody even came in the ER to even check my vitals or nothing. They just left me in there screaming for 2 hours. So living with sickle cell and growing up with it was very hard. Even to this day, I did go through gene therapy, which transformed my life. And I like to tell people now that I'm happier than a hog on a hot summer day in a cool puddle of mud. Because I'm happy. I'm happy because I don't have to wake up 3 o'clock in the morning and drive 100 miles per hour to the hospital and still have to wait to be seen. I'm happy I don't have to deal with those instances no more. But also I'm a little torn because there's no access really. Like a lot of people ask me, "Hey, what do you do about going to get it?" And I don't know what to tell them. So.
So you got gene therapy. Dr. Bansel, can you talk a little bit about Ernest's, the whole gene therapy and exactly what happened with him?
Ms. Turner, before, and Dr. Bansel, before you begin, one of the things, Dr. Bansel, I'm a family practice guy, primary care, and these days, because I'm old, my patients are older. One of the things Mr. Johnson brought up is the discriminatory care that sickle cell, especially older sickle cell patients, when they're pediatrics, they tend to get a little bit more attention, or maybe a lot more attention. Okay, but as an adult, when they get into the emergency room, he described, well, he's just completely ignored, and how some of the physicians and the nurses maybe as well, but how they just tend to think that they're either drug seekers or they're not really paying enough attention to them, not imagining that these young folks can be in that kind of severity of pain since they don't have a cancer diagnosis, as you mentioned that, Frederiana. And so it's just sickle cell, and they blow off the level of pain that these people experience. You've never experienced, and I don't have sickle cell trait, but you never experienced the level of pain that some of these young folks experience, and particularly when they live a little longer than what used to be, okay, in terms of, because I remember back when I started, most of my sickle cell patients didn't make it to 28 or 30. But now when they make it that age or get into the 20s, they're deemed as drug seekers and the kind of stuff that, look, they are in pain. Please help these young folks, help these folks with their pain. But what do, and Dr. Mansell, I'm going to ask you this question, because they transition from pediatrics to adults. How can the adult form of sickle cell get more attention to their level of discomfort and pain when they walk into the emergency room? What can they do to assist them in making their that particular episode especially better?
You're asking a very hard question, one that's, I think, extremely frustrating. And maybe Fredriana, nurse, can comment on it better than I can, but it is very frustrating. And I have tried as hard as I can to advocate for our patients. We've been trying, I don't think any of this is very powerful, but we're trying to come up with things such as like pain plans. So a document that's signed by a doctor that says these are the pain medicines that this patient should be taking, having medical summaries, providing the patients with information that they can kind of back up their claim of pain and so forth, so that it doesn't seem like they're drug seekers. But this stigma is I don't know how to overcome it. It's been very frustrating. We have a few patients who they turn 18, they're still our patients, but they, go to an adult emergency room, or they get admitted to the adult side. And the stories they tell me, their families will call me from the adult inpatient unit and explain to me what's going on. And I'll be like, I'm transferring you to us. We've got to move you over because, these things that are being done are, quite different than how we would do it. I think the biggest things I can think of that are simple is making sure you have a hematologist that you're established with, so that hopefully that hematologist can advocate for you as well. And then, like I said, documentation. But what's really interesting, and going to your point, is that, we've been teaching our teenagers that you need to advocate for your pain medicine. So for instance, if Dilaudid works for you better than morphine, then you need to say that in the emergency room, right? But the problem is, exactly what you said happens, is they sound like a drug seeker, and we're telling them to advocate, but it's coming across as someone who is so savvy about pain medicines that they're, kind of trying to manipulate the system, which is absolutely untrue.
Right.
I wish I had a good answer for you, but there needs to be a big change. And I honestly don't know. The only thing that we've come up with is to try to provide the therapies like what Ernest got, which is try to cure them before they go into the adult world, so that they don't have to face what you described.
I think we have to go to the hospital administration and ask them to educate their staff as far as taking care of sickle cell patients. I know I have, and I don't have as many as I, obviously, since they're a little older, but I don't have as many patients as I did when I was taking care of pediatrics. But when I tell them, hey, go to the emergency room, if they're giving you a hard way to go, call me, let me talk to that emergency room doc, and then I'll turn around and call the emergency room and let them know that I've been taking care of this patient forever. Yeah. They are not drug seekers. Please make this person more comfortable.
And I think that's what it is, the medical provider advocating. I think the more established a patient can be with their providers, and the more we can do exactly what you did, would be really important. I think the other thing is that some of the pediatric or adult hematologists, they'll have like infusion centers where patients can come there and try to kind of take care of the pain before it gets so bad that they have to go to emergency room. One thing we're doing right now, it's actually about to go live, is we came up with a pain protocol in the emergency room in pediatrics. And so then the idea is that it's a prepared order set, so that the ER doctors just know that if there's still pain after 20 minutes, they're supposed to give another dose of medicine. After 20 minutes, give another dose of medicine. There's something called intranasal fentanyl, which we're now trying to advocate that patients get right away when they come into the emergency room. So my hope is that once we perfect that on the pediatric side, then, Wilson's is part of Baptist. My hope is that then I can translate that order set over to the adult side and get some buy-in, so that we can start to kind of protocolize things on both sides. But we're still far from that.
Yeah, I'm sorry to interrupt, but I had to ask.
Yeah, but I think about Dr. Bensel and Dr. Kane, that when I got my knee replacement, my doctor gave me a card. So when I'm going through TSA, I can just show them, oh yeah, I have a replacement, right? So did Fredriana or Ernest, can they not receive some kind of card to show that they are, that they have sickle cell disease, and that way they
Yeah,
won't?
and that's what the pain plan is. So like those medical summaries and all. And I'm going to be honest with you, we haven't done a great job up till now of really formalizing that process. So Fredriana and Ernest haven't really been able to benefit, but we are creating those things now, including pain plans, so that it's listed there. These are the patient's doses, these are the medications, so that when they go into the adult world, they can just show that and say, look, this is what my doctor said I'm supposed to get.
If you're just tuning in, we're talking about sickle cell disease. Call in. All of us know someone who has the trait or who has the disease. This is an opportunity to ask this amazing panel of folks who are advocates, who have lived experiences, the medical experts. Dial in, put a question in, and just ask your questions. So I do have to get back to Ernest and Dr. Bansel by saying, because you said it and he alluded to it. So Ernest does not have sickle cell. He's been cured.
Yeah.
Wow.
I'm so happy for him. It's really becoming a game changer. It's actually surpassing kind of our expectations for how it would perform. So we're very, very excited about it. And my hope is that over time, right now, our biggest challenge is insurance barriers, trying to get approval, because gene therapy costs, depending on there's two products. And between the two, it's somewhere between $2.5 and $3 million for a treatment. And so you can understand that the insurance companies are not quickly approving those. They're asking for some data, some proof that it's necessary. But we're getting there. We're getting there. And so we're really excited that this is going to be the wave of the future.
Wow, that's very awesome. And Selena, do you do fundraisers to help families, help support families? And James, I'm going to get to you. I haven't forgotten about you. But Selena, I want to get back to you because I know you do a lot. I know you do the social activities, but do you also do fundraisers? Because there may be somebody out there. They heard Dr. Bansel say how expensive it is. But what can people do other than donate to the Richard Webster Bass Health Institute?
Yeah, so absolutely. We definitely need funding. We need funding to do the support activities, to do the social activities. We also provide financial assistance. Just last week, a mom could not pay her rent. So we helped out with that. Mom could not pay her light bill. We helped out with that. When SNAP was cut, there were many families that were impacted by that. We provided gift cards to Publix for that. So yes, we do need funding, and our website is richardwbhi.org. I also have a children's book. This is called Rainbows. That's Richard superimposed right there. And so the book is $25, and the proceeds goes towards scholarships and support activities for our families. So they can reach me at Selena at richardwbhi.org. That stands for Richard Anthony Webster Bass Health Institute. So we definitely need funding, but people can also give blood. I mean, that is
going next, yeah.
Sacrifice. I'm a minister, and we're all about loving and sacrifice. And what great way to show love for the sickle cell community than to give of yourself, to give of your blood. And so we're really excited to have Mr. Khan, on from Life South Blood. We've partnered with them to do blood drives in the community, and we did one at my church. We've done others in the community, one at the Children's Museum. So they're a great partner, and we really need people to give blood because many of the sickle cell families undergo blood transfusions.
Well, now that you mentioned Mrs. Khan,
just to add to that, I'm sorry to interrupt. Okay. To add to that, the other thing is becoming a donor on the bone marrow registry, because there are not enough African Americans who are donors, and so it's very difficult to find a bone marrow match because that's another curative therapy. So the more people that can do that, the better. Sorry to interrupt.
And how do you pursue that, Dr. Bansol? If folks just don't know how to even get started, do you just talk to your primary care physician about it, or how do you pursue that?
There's a program called Be the Match. And so I
Okay.
can pull up the website and provide it to you if anybody wants to.
And we can put it on our website. Thank you. Thank you so much. So, James, we're friends now. I'm just going to call you James because I'm going to
James
botch
works.
your last name, James Scon. So,
Gone, yes.
James, what challenges does Life South face in maintaining an adequate blood supply, and how can people host a drive at their church or business or what have you?
I mean, they can get in contact with us to start. And I appreciate you guys having me on to talk about this. Especially in the summertime, we have a real hard time getting enough people out to donate for our local hospitals. If you have a group of people that want to host a blood drive, I mean, I give my cell phone out. It is on like most of our PR materials. But we want to hear from you. And even if it's like a small book club and you have 5 or 6 people, we'll come by for a few hours and then move on to something else. But the need is always there. I mean, blood doesn't stay on shelves forever. It's obviously it is a form of treatment for sickle cell. It's also necessary in traumas and all cancer treatment, all kinds of things. So yeah, we're always happy to hear from groups that are interested in hosting something. We can come out to neighborhoods. We can come out to, like you said, churches. And we always love to. We're always in need. If you see us in front of a Walmart, it's because we had nothing better to do that day. I hate to say it that way, but like we want to come out to communities that want us there. So yeah, reach out. Life South. We're the ones that supply UF Health, Baptist, HCA, so all the local level 1 and level 2 trauma centers in the area. And yeah, we're always very appreciative to have people that want to host. If you don't have the ability to host it, you don't have a location or a group that's really interested, you just want to do it, just go online. Lifesouth.org is our website. You can find something in your area. We have multiple buses out every day. And yeah, we're the red, white, and blue ones. So if you see us, we're the local guy. Step on. If you're not sure if you can donate, because there's a lot of misinformation, we love to answer questions too. You can jump on the bus. And maybe somebody 10 years ago told you couldn't donate. Might not be the case anymore. There's things like travel advisories, like if you were stationed in Europe in like the 90s and early 2000s, I believe. There was like we weren't able to take your blood in America for a good while because of mad cow disease and the scare there. That's no longer an issue. Testing is good enough. We don't have that FDA regulation anymore. But things like that.
So tell us about the blood donation process. So if someone, after listening tonight, says, you know what, I got to give. So what's the process? They have to do any preparations, eat a lot of protein, or not smoke weed for people who do that? I'm just saying. What?
No, it's great. I appreciate you saying that specifically because it comes up a lot. People think like, well, my blood's contaminated, so I can't give. No, like we don't mind that specifically at all. That wouldn't change much on our end. If you are, we'd like you to be sober when you show up, so you're making a consented, you're consenting and able to consent to a medical practice, a process. But yeah, if you're at an event and had like a beer or something, that's fine. If you smoked and the other day, that won't change anything about your blood on our end. So yeah, no, like don't allow yourself the excuses. If you're not even sure, no one's gonna like start throwing stones at you when you walk on the bus if you say something like that or ask something like that. We always want to answer those kinds of questions. And yeah, that wouldn't prohibit anybody from donating specifically.
What are the typical misconceptions people have about donating?
So a big one that comes up a lot because it was a regulatory thing, and I think it still is in some states, but in Florida, it isn't. If you got a tattoo recently, people will just point at like their new tattoo and say, "Oh, I just got a tattoo. I can't do it." Well, if it was in a regulated parlor, those are well kept. That the FDA doesn't make us stop you from donating if you just got a tattoo. If it was in someone's basement, I believe it's a 3-month. Don't quote me. It might be a 6-month hold on accepting blood, but there are a lot of them. A ton of people come up with a lot of really random stuff that they think keeps them from donating, but a lot of it's not true. So sometimes people are just looking for an excuse because they don't want to donate. But like, it's really useful, obviously, in the case of sickle cell as a treatment, but also in general for our community. And we end up importing some of the blood that we use in our hospitals from other parts of our footprint. Like there's a lot of generous folks in Alabama, for instance, because we don't have enough people in the greater Jacksonville area
Wow.
actually coming out and donating or hosting these drives. So we're an emergency need more often than we aren't here locally.
So
I
I
don't know if
look
that
at
answers the
some.
question, but it's a
Oh no,
big
it did.
issue I like to
But I
point
look
out.
at someone like Fredriana and Ernest. Is there a minimum age that you have to be in order to donate if your parent consents?
That's a great question. 16-year-olds, we require a permission slip. So if you're 16 and over 110 pounds, if you're 16, you can donate with permission from parent. 17 and up, over 110 pounds, you're good. I mean, we give you a quick physical. I guess I can walk through the process. You asked me that earlier. You either come to one of our centers or jump on one of our buses.
Mhm.
We get you in the system. Pretty quick process. We give you a quick physical, make sure you are healthy to donate. We don't want to do anything dangerous for you. You know, check your hemoglobin, your blood pressure, just things that might be relevant and pertinent to that. You answer a series of questions to make sure there aren't any FDA regulations keeping you from donating. Again, a lot of those have changed in the last decade, or even, I mean, day to day, those things sometimes change. And then, you know, ideally, we place you right in a seat. That process is actually pretty quick. We can tell you when to look away for the needle. A lot of people tell me they're scared of needles. But it's a pretty hands-off way, besides showing up, making the appointment, hanging out with us for a little while, way to save someone's life. You can sit there and scroll on your phone on your other free hand, and you're helping people. And yeah, no, that's the process.
Can
And-
a
and
person
just to-
with sickle cell who has sickle cell or the trait, can they donate blood or do they typically donate?
They can, and I mean, I would urge specifically Black Americans to donate because we try to match people's blood with these transfusions for sickle cell
Okay.
with people's blood that matches. So the people with the most genetic markers that are going to match for a recipient of these transfusions are going to be also Black people. So we want donors.
Okay.
We want a diverse blood supply no matter what. Like
Right,
that's
absolutely.
essential. People with sickle cell can donate. Yes, sickle cell trait.
Yeah. But we won't give that blood to a patient with sickle cell disease. So a patient who's got a donor sickle trait or sickle cell disease, we specifically ask that the blood not have either sickle trait or disease when they're given to a sickle cell patient.
Oh yes, for that, yes.
Dr. Bansal, what about someone with other blood disorder like beta thalassemia?
No, they can donate. I think the only thing is just that, you know, you have to have like a baseline hemoglobin to donate. And so some people who have beta thalassemia trait or beta thalassemia, you know, more severe disease can be maybe a little bit too anemic to be able to donate. That would be the only rate limiting step, I believe.
So, Mr. Scott, you know, we're always hearing about donate blood, but usually it's to a different organization. Are you guys competing with each other for the blood donations, or how does that work?
Yeah, I mean, yes. We're not the other group. The big red buses that you see are a different group. They're saving someone's life too. So I don't want to throw any shade their way. They're a great organization as well. It's the hospitals we service. So like when I say we're the local guys, that's what I'm saying. We do all the level 1 and level 2 trauma centers. So UF Health, Baptist, HCA, in the greater Jacksonville area, the North Florida area, that's us. So if you or your family are in some kind of a traumatic accident, we also give blood to JFRD on their ambulances, Life Flight, Trauma One. So really, if you're in some kind of a harrowing experience here locally that requires blood transfusion, it's going to come from one of these blood drives we do with Life South specifically. They're a different organization. I believe, you know, I don't want to speak to their stuff. I think that they have St. Vincent's. But yeah, they service other hospitals.
Now, do they also reciprocate with you guys in terms of giving blood to share with sickle cell patients? How does that work?
I mean, I'd imagine it depends on where you're getting your treatment. I mean, a lot of conversation we've had today seems to center around like Nemours and Wolfson, and those would be under like the Baptist hospice. So those are help, assisted by us. So the blood they're getting is coming from Life South. But I imagine that they probably, you know, give blood to sickle cell recipients as well.
So I have to get back to Ernest. Ernest,
Hey.
I'm not. Don't think that I was forgetting about you, because I have to ask, how has your life changed since receiving gene therapy?
No more pain. That's the biggest thing. I'm able to work out. Um, I made a video. I was saying, man, I never did push-ups before. Uh,
Mm, wow.
uh, and then it gives me a sense of hope. Having sickle cell, sometimes I didn't always see a future, didn't see it, didn't know whether or
Mm,
not I would have kids, find love.
wow. That's powerful. That's
Because
powerful. How
like
is
you
it?
see so many people, you know,
Yeah.
that pass away from it, and it kind of gets discouraging, especially when you're in the hospital. You kind of feel you like felt like, oh my God, this might be it.
Because you were in so much pain. You have any other family members, if you don't mind sharing? You don't have to if you don't want to, who also had the disease or the trait that you
Um,
know of, or experienced the challenges you did, the pain, and
so
you don't. If you
just
don't want to talk about it, you don't have to.
not just it's okay. Just last year, my little cousin, uh, he was 22,
Take
and
your time.
when he passed away,
Mm,
he had I guess he left us his code to his phone,
mm-hmm.
and then at the funeral they were just saying like all the notes that he had, and I remember one of them was like, God, I don't know what I did to be in so
Mm.
much pain, but I'm so sorry. But other than him, just me.
So what concerns or fears did you have? And I'm so sorry for your loss, and what a champion you are, though, to tell your story, to have the courage to tell your story and make us laugh in spite of the things that have happened with you about going to FAMU. And Dr. Kane chimed in, by the way, because he's a rattler, so it
Mhm.
always have to. I'm surprised he didn't do the
Oh yeah.
strike with you. But did you have any concerns or fears before undergoing the procedure?
Um.
You just was ready to stop having pain.
Now I was confident. Cause my doctor, Dr. Rivera, he prepared me like 10 years before, because I remember telling him, man, let's just get this over with and let's do a bone marrow transplant. And he was telling me, hey, bone marrow transplant is kind of risky. Let's just be patient and wait for gene therapy. So he would give me articles on gene therapy, and get like show me 60-minute episodes, and he just prepared me for the moment. So he just always told me that was like at the end of the tunnel, and I just had faith.
Awesome. Dr. Ban, so who's a candidate for it is, and I don't want to, specifically talk about Fredriana, but I'm seeing her sitting here on the screen. Who is a candidate for it? Who makes the decision other than the insurance companies? Awful, just awful. But
Yeah.
to determine who is a candidate for gene therapy so that more people
So
can be cured.
So the first thing is they ask if they have what's called a match sib donor. So in other words, if they have a full sibling who is a perfect match, donor match, then the insurance companies will say, well, you have to do a transplant. You're not going to be a candidate for gene therapy. So we have to do the bone marrow typing for the patient and any full siblings to make sure we establish that. Then there are also a few simple things they want. They want us to do HIV testing, hepatitis B testing. And then also there's something called alpha thalassemia, which can be a little bit of a problem with gene therapy. So they want us to test for all those. So if they meet those criteria, and then generally speaking, they say that the patient has to have had 2 to 3 pain crises in the past year. So in other words, clinically severe sickle cell disease. So those are the main criteria. Then we go to insurance and ask for approval. We are getting approvals. It's just not every patient gets approval quickly, but it's getting a little easier. And what's really impressive is that Florida Medicaid has actually been the best at giving us approvals for gene therapy, as opposed to a lot of the private insurance companies and TRICARE. So we're very hopeful. I see the question there about financial help. If you get approval by insurance to get the gene therapy, then it should be covered entirely by insurance. And included in the package of gene therapy is the companies are providing things like transportation for families if the gene therapy center is too far away. So, providing to make the process easier. The other thing they're doing is fertility preservation, because we have to give a little bit of chemotherapy to make gene therapy work. And so we want to make sure that if they're male, that they can do sperm banking, for females be able to do egg harvesting if they want to, so that later on, after the treatment is done, if they choose to have kids, they still have that possibility. And this hasn't limited them. And that's covered by the company.
So Dr. Banzel, what kind of timeline are you seeing with these approvals from start to finish?
Approvals, I think I usually am saying about 6 months, jumping through the hoops. And then if we get approvals, then the next step is harvesting. So it takes a few months to actually collect the bone marrow cells from the patient. And then they have to go to the company to be manipulated. So I'm going to say, to be quite honest, the whole process from beginning to end, I would give it about 1.5 years to accomplish everything.
But like what Mr. Johnson said, light at the end of the tunnel is, I guess, that may be driving them to be able to wait that 1.5 years, because if and I can't imagine what kind of pain they're in, but I could not wait to get it done if it was me. Given the description, Mr. Johnson.
One other problem we're having right now is where to get the gene therapy, because Mayo doesn't do gene therapy anymore. Ernest was lucky enough to get it done there, but they're not doing it anymore. And so there's no adult center in Jacksonville. You'd have to go to Gainesville to get gene therapy. And I'm not sure if they're doing adults. For pediatrics, UF Gainesville is doing it. We are like literally one minor step away from being able to do gene therapy. We have a couple patients who we have insurance approval, and we just need to handle one logistic issue. And then once we have that, then we're good to go with gene therapy. So there are more options on the pediatric side, but remember, gene therapy is only approved for ages 12 and older.
Anything we can do to help assist with that minor, I'm gonna say minor, but that process
actually, Life South is going to help us out with the little hitch that we're dealing with, which is we just need to find a way to receive the manipulated cells, thaw them, and then provide them to us at the very end when we're ready to infuse. And actually, we're talking to Life South about helping us with that. So I'm very hopeful we'll get that done soon.
Fantastic. So listen, the hour is almost up, and I want to ask each of you a final question. Selena, I'm going to start with you, and I'll call the rest of you out. I want to ask you, first of all, you and Frederian, all of you are such champions or advocates for this. How can people help? We talked about donating money, donating blood, donating bone marrow. But how can they help you if they don't know how to just jump out there and become an advocate? Contact you, and you'll walk them through how to become an advocate. Tell us about it, and then also talk about what gives you hope about the future of sickle cell care and treatment.
Thank you for those powerful questions. So one, funding is so important, and we are accepting donations. Typically, I write small grants to, keep us afloat. But as you know, things in the political and social landscape have changed a whole lot. So we need funding. We need dollars. So again, they can reach me at selena@richardwbhi.org. We also need volunteers, right? So when we have events, we need folks to help us set up and to break down and to greet our, sickle cell families with love and with compassion. So your time, your treasure, and then certainly giving of yourself. So donating blood for our sickle cell family so that they can have a beautiful and quality life. What motivates me is one, my relationship with God. I have this scripture that's one of my favorite scriptures, which is weeping may endure for a night, but joy comes in the morning. And so when I started studying sickle cell back in 1991, we were talking about butyrate as a treatment, increasing the fetal hemoglobin, keeping that switch turned on so that the adult hemoglobin, we had all of these ideas, but now, we're actually seeing gene therapy. We're actually seeing bone marrow transplants and stem cell transplants, all of those things, right? So my hope is the science, but it's also the hope and the faith that we have and the resilience that we see in our sickle cell family. So that's what I'd like to do with tonight. And again, thank you for having us on.
Thank you so much. Frederiana, what about you? What are I know we talked to you at the beginning, and I promise I didn't forget about you, but what gives you hope? And what's your motivation to continue to advocate as you live with sickle cell disease?
Yes, ma'am. Thank you for asking. I would have to agree with my aunt. My main source of motivation is my relationship and my intimacy with God, our Creator. A verse that I recently discovered is from Second Corinthians. And God is speaking to Paul. He has a thorn in his side. He has a physical ailment such as sickle cell. And God tells him that my grace is sufficient for you. Paul prays to God. He prays for a healing. He prays 3 times. He has enough faith, but God says, my grace is sufficient for you. I gave you this ailment for a reason, and you are strong enough to deal with it. And so that's the perspective that I have on sickle cell at this point. Of course, I want to be cured, and I'm praying, if God is willing, I will be cured one day. But as I am dealing with it and coping with it, God's grace is sufficient for me. And then also, of course, the sickle cell community, having these little events, having my support group, creating these care packages. I honestly am healing myself by healing others, by encouraging others, and bringing us all together as a big family.
So do you have a nonprofit? Is that what Project Little Veins is?
So it is not a nonprofit. It's actually under my aunt's nonprofit, Richard Webster
Okay.
Bass Health. It
Okay.
is a program, Little Vein Sickle Cell Awareness.
Okay. All righty. And thank you, Dr. Bansel. What gives you hope, and what final words would you like to share with our viewers?
What gives me hope are the people on this panel, having people such as Selena working so hard to advocate for the disease, amazing patients such as Frederiana and Ernest who are, supporting the cause and telling their story. When I was in medical training, I was fortunate enough to work with mentors who, taking care of patients with sickle cell disease kind of fell in my lap. I worked with Dr. Ohene Frempong and Dr. Kim Smith-Whitley at CHOP, at Children's Hospital of Philadelphia, and they're leaders in the sickle cell research world, and they really guided me through this journey. I think it's a population that's underserved and needs advocates, and so I will try my best to do that.
Thank you so much. And Ernest, I'm gonna save you for last. You just hold on. James, what are your final thoughts? And remind people of how to reach out to donate or set up a drive at their location.
Yeah, please reach out to us, lifesouth.org. And honestly, if no one cares, my cell phone, literally text me, 904-586-5090. I'm always happy to talk about hosting blood drives. That's like most of what I do. And I'm always inspired by the work of people like Selena. I'm kind of blown away by some of the experiences that we've talked about here on the show today. But if people want to come and help out with that component of it, I'd encourage them to at least try to make an appointment, come out, or if you just see us in passing and see one of our buses, jump on them. See if you can donate if you've never done it before. It's really not as bad as some people pretend a needle is. So yeah, that's my message to people. Go donate blood.
Thank you so much. And Ernest, I didn't ask you how you're living now, but I'm assuming you look like you're doing absolutely amazing. But what are your final thoughts? I'm so happy, extremely happy for you. And I wish so much success and happiness for you.
We're talking about hope. I think stuff like this would give people hope to see, how someone with their same illness doesn't have the illness no more. And I came up with something called CMC. It's choices manifest changes. And I feel like you got to choose to want to learn about gene therapy. Like my algorithm on TikTok, I sometimes comment when people are alive in the hospital and I mention gene therapy, and they'll say something like, "Yeah, don't you got to get chemo?" Oh, no, I ain't getting that. But in reality, that was just, I think I went through 2 to 3 weeks worth of like agony. And I'd rather do that 100 times before I go through a lifetime worth of pain. So you just gotta have faith that, it can happen.
Thank you so much, and so much blessings to you. Dr. Kane, what are your final thoughts as we wrap up tonight's discussion?
Well, tonight we pulled back the curtain on a disease that has been overlooked for too long. Sickle cell affects, as Dr. Stated, that we have 100,000 Americans, mostly the vast majority are Black, and millions more worldwide that suffer from sickle cell disease. It's shortened their lives by decades, obviously, causes relentless pain, and it's received a historical fraction of the research funding given to other diseases. And truth be told, that affect predominantly white patients. The good news is the gene therapy that our guest has had that might cure it. But the hard truth about that is almost none can access it. Okay, it's got a $3 million price tag and 2 million and too few treatment centers. There's insurance barriers. There's federal research funding that's under threat under this current administration. And so when there's a message that, hopefully that will unify us, that the science is ready. And what we need, now what we need is the political will and the financial will and the moral will to match it. So let's secure this and now make it much more reachable. We need to advocate to our political
Elected officials.
political officials that we need to move forward on providing the funding for gene therapy and, as a matter of fact, just any treatment associated with sickle cell, because at the moment they just, as was stated earlier, they just stick you in a corner, and sometimes they just stick you in a corner, and all this pain that occurs while you're in the emergency room, and it's unnecessary. When we can just go on ahead and start approving more gene therapy that can help many of those who suffer from this get cured.
Thank you, Dr. Kane, and thank you to all of our guests. As we conclude tonight's discussion, I want to thank each of our guests for sharing their expertise, experiences, and personal stories. To Dr. Selena Webster Bass, thank you for your unwavering commitment to advocacy and community support through the Richard Webster Bass Health Institute. To Fredriana Copeland Webster, thank you for courageously sharing your lived experience and helping us better understand the realities faced by individuals living with sickle cell disease. To Ernest Johnson, thank you for offering a powerful example of hope and possibility through your journey with gene therapy. To James Scott, thank you for reminding us that blood donation is not just an act of generosity, it is often a lifeline for individuals living with sickle cell disease and traumatic injuries. And to Dr. Manisha Bansal, thank you for helping us better understand the medical advances, challenges, and opportunities that are shaping the future of sickle cell care. Tonight, we learned that sickle cell disease is more than a diagnosis. It is a journey marked by resilience, courage, determination, and hope. We also learned that every one of us has a role to play, whether through advocacy, education, research, supporting affected families, or becoming a blood donor. If there's one message we hope listeners take away tonight, it is that awareness leads to action and action changes lives. We encourage everyone listening to continue learning, share what you've learned with others, consider donating blood, and support organizations like the Richard Webster Bass Health Institute, working to improve the lives of individuals and families affected by sickle cell disease. On behalf of my co-host, Dr. Rogers Kane, and our behind-the-scenes technology guy, Tyrone Jackson, and thank you so much for joining us this evening, and tune in next week. And don't forget to subscribe to our YouTube channel. Good evening.
We appreciate you spending time with us on Pause for the Truth. Ms. Jocelyn Turner and Dr. Rogers Kane are grateful for your support. Don't forget to like us on Facebook, catch us live on Twitch, and most importantly, subscribe on YouTube. A big shout out to Tyrone Jackson at Call Tyrone IT Services for keeping us connected. Join us every Tuesday at 6:30 p.m. Eastern Standard Time for more enlightening discussions. Thanks, and see you next week.